Hi, everybody. This is Kara Thrasher Livingston with Senior and Disability Services, and I am here with Cassandra Lynch and Delight Mills, our training team, to talk about to participate with you in our Care Coordinator monthly outreach. And we do have a couple of things to share. I would go ahead and encourage you to, of course, write in your questions in the question area if you have them. We'll do our best to address them. And I'm going to go ahead and share my screen here so I can see our agenda. We've been having a little bit of an adventure with our webcams and things like that. So we'll do our best to share our webcams if we're able to do so. They may be taking up a little bit too much bandwidth right now to actually work, but that's okay. We are here. Just a quick check-in with you. Are you able to see our screen? Are you able to hear our voice? Go ahead and give us a thumbs up or give us a hand in the raise your hand for us, if you will, in our session there, using your controls. If you could possibly do that, that would help us a lot. If you could raise the hand and let us know that you can see at least our screen. Okay, awesome. All right. We'll try to use our webcam again as we go on here, but I did want to let you know that we're here, and just we'll talk a little bit about hopefully you can see our 3 topics here, and then we'll get to your questions. Delight, I know that you're here and you're prepared to help us understand more about how to activate a backup care coordinator in Harmony. This is, of course, targeted towards our sole proprietor care coordinators. However, it is also available to any care coordination agency should you choose to do so. So go ahead, Delight. Do you want me to let you go ahead and share your screen? I'll change the presenter to you. Would that be?
I got it, I think.
You got it. Okay. Yeah, you got it already. Okay. Awesome.
All right.
Yes.
I'm quick about it. So
Yeah.
I just want to let you all know that in the handouts area of your webinar, the latest January 2022 care coordination guide for Harmony is in there, and I will be emailing it this afternoon to all care coordinators. There's both a Word version and a PDF version. It's the same version. We do want you to discontinue using any previous guides that you have on your computer, print it out, and print the latest version. What changed in this guide? Essentially, we have put in a couple of appendices, like appendix items, about backup care coordination. So the last part of it has a write-up on how to request having your backup care coordinator access your caseload, which Kara talked with you about last session. And in order to make that request, we needed you to contact the CERT team. So I'm a little ahead here. I'm going to go up 1 page. So in order for you to get your backup care coordinator to access your case records in Harmony, you needed to email SDS certification to request that your backup have access to your records, identify your backup or backups if you have multiple, and copy those folks on that email, and then put in any effective dates if you're deactivating or changing. So sort of like if you had someone as a backup and then you're going to have someone else take over to deactivate. And this is specific for certification, okay? So as far as people having access to all of your records. Once you have that in place, your backup can then search for your clients in their consumer record. So I have here the Harmony system, and if I wanted to look up a client that isn't my client, but I'm backing up my care coordinator, I can search for them in the consumer chapter. So clicking on the consumer chapter, I could do a search, an advanced search for that person's name, or I could pull all clients that are tied to both me as a care coordinator, my backup, and to my agency. Some of you are already in an agency and you already do this. But those that are in individual agencies, this means that you can see both of each other's agencies when you're backing each other up. Let me see. Someone's asking if you're within the same agency, you can access a consumer record using the consumer last name search. Yeah, so I am going to just search for a training client, like anyone with the last name training that I'm tied to and that my agencies, that my backup's tied to. So if you look at my profile, I only actually have one client in here, and it's just this GR client. But because I'm connected, like in the backup process through certification, I can see everybody that I have access to as a backup care coordinator. So this takes us to the next step in this of what do I do when I need my client's notices to go to my backup for a certain period of time, such as, I'm going on vacation, I'm going on maternity leave, or something has happened and I can't help that person, and the backup is going to go in and set a activation status for this one client. So the instructions on it are pretty straightforward. You're going to create a change of status note. But for you to trigger this, it has to be in each one of the clients that it's relevant to, and we have to specify the time frame that this is going to be occurring. So this is not a change of care coordinator. This is an activation of a backup for a limited period of time. If any case action happens while the backup is activated, both the care coordinator and the backup would be note recipients on that case. Once that time frame has been ended, then the notices will stop going to the backup care coordinator. So how do I do that? Well, I'm just going to go ahead and jump into this case right here. And I'm moving into the Notes tab. I'm in the Consumer Notes tab here. So that's just keep track of which notes section you're in. We're in Consumer Notes. I'm going to File, Add a Note. And then in our program, I'm putting in ALI. The note type is Change of Status. Our subtype is Backup CC Activation. And then in the description, this is the line that we see on our main notes page. So we want you to just simply say to the effect, Jane Doe is active from, let's say, 01/15 and for a month, 2022 through 02/15/2022. I could provide additional context if I need to, but what's really important is we identify the backup care coordinator and the time frame that they're going to be operating. So that's the big pieces there that you need to make sure you have within this note. SDS is going to check and make sure that the backup does have access. If you set this status and you put in this note and set it up and turn it in, and your backup doesn't have access to your case record, they're going to respond back and say they can't process this change of status. So you have to take the first step of having certification add the backup before you can have your backup get notices on a case file. Okay, so where are we in our guide? We're still on the same section. We need to make sure that we've put in our description, and then you could put in a longer description. Final step is to make sure we set our status to submitted, and then we save and close the note. Okay, so critical, we save it in a submitted status, save and close it. All right, so I'm going to go ahead and do that. Save and close note. And I should see my note within the notes tab that has backup care coordinator or backup CC activation. It says that Jane Doe's activated and gives the time frame. So within this time frame, anything that happens with this case, I'll get copied on it, and Jane Doe would get copied on it at the same time. We'd both be note recipients so that Jane could cover for me and make sure that our client is taken care of. So with that, I see that we have some questions in the question box, so I'm just going to check to see that. Some of you are saying, well, I put my backup in when I did my original certification. That's fine. That's what you're supposed to do when you put in your certification, either you're recertifying or your initial certification, you identify your backup. In order to get your backup to have access in Harmony, you need to email the certification team and request that. Or when you renew or when you recertify, they're going to take that process on then. Okay, so if you want your backup to have access now, email them. If it's not a big deal, you don't have to do it. It just won't happen until you recertify. A couple of other questions in here I see. What's the turnaround time for SDS to do this? 24 hours, 36 hours? Like with all processes in Harmony, it depends on the queue that was put in. So how many people ahead of you put in work, and how well staffed are we with SDS at any given time. The change of statuses move very quickly. So I would suspect that it should probably be in effect within 2 to 3 business days. That's pretty standard processing for the change of statuses. If you're concerned about it, you're the backup and it's been initiated, you can always reach out to the unit by DSM and say, I need the notices. But I would wait a couple of business days so that we can process it. A couple of other questions. The notifications, do they stop when the backup is activated, or do both care coordinator and the backup receive them? Yes. So the appointed care coordinator, primary care coordinator, will always receive the notice. When a backup's activated, they'll also receive the notice. So no matter what, you'll both have those notices at the same time if it's activated, and it's for that specific date time frame. If you don't specify a date time frame, it's not going to get processed. They will return it to you and say that we need the time frame that there's activation. Okay, I'm looking a little bit further back. So a couple of questions. I'm the backup for someone, but they're not my backup. How does that work? It contact the certification team. They're better at explaining it than I am, but it's kind of one direction. So you can back someone up and see their stuff, but unless they connect you that way, you won't see their stuff. There's some cross sections. So talk to certification if you have questions about that. Looking back, I think I got all of your questions about this particular piece. Oh, okay, here's a big one. Does this have to be done for every individual on the caseload one by one? Is there a way to do it for our entire caseload at one time? There isn't. You have to do them one by one. So that's your business call. If you're going to be gone for a week and you have 50 clients, you may want to assess your client load and decide, well, I only have 5 cases that are really, really active right now, and I need those to be monitored, right? Like you have a couple support plans in, you have a couple of assessments out, something like that. You can limit it and just do 5 cases out of 50. Alternatively, you could do all 50. It's up to you and your business practice. But I would encourage you to consider if all of those cases need to be monitored for a time frame. So this is really specific to what you have going on, why you're going to be gone, for how long are you going to be gone, and how active your cases are during that time frame. Do you need all of them to be tagged, or just some of the ones that are currently active because you just put in a plan or you have something happening that would require that? Remember that your backup doesn't have to be formally activated like this if they need to take action. So you may have a case where you left thinking you didn't really need to activate a client, right? But they had something happen. The backup could still help them. They could still access their records and make the filing for them. And the backup could also file this change of status backup care coordination activation. They could file it themselves if they needed to start getting copied if you didn't do all of the client loads. So just thoughts to consider when you're preparing to leave for an extended period of time that would mean that you need your cases monitored in Harmony. Kind of looking for a couple more questions. So SDS doesn't want ROIs for backups and CCs. Do we submit them through a note in Harmony? Hold off on doing any ROIs unless you're requested to when in your capacity as a backup care coordinator. We're not asking for you to file those in order to do this business at this time. Should it be necessary, you'll be requested. That could be requested at any time. As you guys know, like anytime they might request an ROI, but it's not needed for requesting your caseloads to be accessible to each other, or to be able to look in and find a case. And it's not required for initiating the notifications. All right, we're all certified Medicaid providers, and part of your process of working with your client should be introducing them to the backup and making sure they know that they can contact them if there's an emergency. What's the process when a care coordinator is unexpectedly incapacitated? This would be where the backup would go into the case record and should file the change of status backup CC activation on behalf of the primary care coordinator. So if you are not able to file the change of status, the backup care coordinator could do that. If our certification team has already connected your caseloads. If they haven't connected your caseloads yet, and something happens and the backup has to reach out, then they should contact certification and let them know what's going on as far as why the care coordinator is incapacitated, and would work with you to figure out how we could get you connected correctly and what would need to be completed for that process. Okay, couple more questions. Let's see. I think a couple more. Once the time frame is up, do we have to make a new note saying that the backup no longer has access, or is it automatically revoked upon time expiration? It will automatically be revoked. To explain how this is going to work in Harmony on the SDS side, when you put in this note, SDS will make sure that the backup has access, and then they're going to change this note to pop up a little window whenever we go into this file, and it's going to say backup care coordinators activated and has the time frame. When a SDS staffer goes into the case file after the time frame, they will turn off that pop-up, and from there, the backup doesn't need to. The backup won't receive any more notices. So this is a one and done kind of turn in for you. You turn it in with the beginning and end date, and then when that time frame ends, the backup no longer gets copied. Okay, looking for more questions. So what if I'm someone's backup and they're not my backup? Make sure that you talk to certification about how that's connected. It is possible for that connection to happen. So you can see their caseload, but they can't see yours. Yep, they can do that. I would encourage you to be really clear in your email contacts about that, that you're their backup, but they're not yours. Being very clear when you are communicating that, but it's possible to build it that way. Yes. Yeah, so a couple more questions. If the primary care coordinator is incapacitated, the backup can come in and file this activation for the clients on the primary's caseload. Yes, that can be done. I think that covers all of your questions for now. There are a lot of other questions that I see in here that are relating to app Ks and to reg changes. So Kara, do you want to take over on the agenda and cover what's next? The only other big thing that I can think of is, is our calendars updated. We have that.
Yeah, our calendar is updated. Still trying to show my video if it's going to come alive. If it's not going to come alive, I'll just call it a loss there. I think it's not, but okay, that's fine. We can either, well, we want to call attention to the fact that that the training calendar is available again. Once again, let me change it so I can show my screen here.
So you can go to our training calendar on the main page.
All right, go to the training calendar on our main page, of course, and that is going to show you our traditional links that we're used to dealing with. You can go down to the, let me move a few things around here so I can navigate a little better. Okay. You can find our training information here under resources, schedules, and calendar. You can go right to the calendar. It is a Google Calendar, and you can locate classes here, and you can also register for them. So if you need Harmony training, you can go ahead and click on that, and you'll find a link down below where you can sign up for it. There are at least 3 months of classes in here. The way that you navigate this is, best way to do it is to use these little arrows and go to the right, and there you'll see February, and we have a CEH about CFC in February. We're still developing that, of course, in March. You can register. You can always, have to register, but you can always see the link to our training office hours there on any given Tuesday or Thursday. So we wanted to make sure that you knew about that. We talked about activating the backup care coordinator. We have a new edition of our Harmony Care Coordinator Guide, T24. It is available in the download section of the handout section, I should say, of your webinar itself. We do have it available in either a PDF format or Word doc. We can also send it to you if you're unable to download it out of the webinar itself. Sometimes it works and sometimes it doesn't. Depends on your device. It depends on if your device is able to download any. Sometimes phones don't download, or tablets might not be able to download. But we can send it to you regardless, and I'll probably drop everybody a nice, follow-up email. In case you missed part of our session today, we do also post it on our YouTube channel, so I'll send us a link. Please be a little bit patient with us about links to YouTube. It's taking us quite a while to get a video uploaded, but we will get that to you. We'll work on having that done by the end of the day today. We wanted to address, I see lots of questions coming in about the announcements that went out regarding, well, there's a couple questions about AppK. We'll get to those. There's questions that went out about the third-party liability announcement, and we have had some questions that have come in about the waiver amendments and the regulation, proposed waiver amendments, I should say, and proposed waiver regulation changes. So I am showing us a basic resource on those three things here. And before, well, actually, we could do that first. Third-party liability, I just wanted to clarify. I have it answered also in writing in our question chat. Please email Courtney King about your third-party liability questions, and that would be the announcement that went out about billing and billing other insurance resources before billing for Medicaid. And everything and anything under the sun that you have a question about that regarding, you need to send to Courtney King, because she's part of that team who's taking care of that. If you have questions about the waiver amendment proposed changes, these next two here are sort of the same, but a little bit different. Waiver amendments, as you know, probably know that Senior and Disability Services has to reapply to CMS to implement its waivers. And so what we do is we go through a public comment period because we want to make sure that our waivers are administered in the ways that work for the people we serve, right? That's the nutshell reason. So proposed changes to waiver amendments, we have a website that explains them with lots of documents about the old one and the new one, or proposed ones, I should emphasize. You may also email Jetta Whitaker with our policy team with your questions about waiver amendment proposed changes. There is an explanatory webinar tomorrow. You can register for it if you have not. I did send it out to all of our current care coordinators so that you're invited to register for that webinar. And it is an explanatory webinar to just talk about the waiver amendment proposed changes, and also to take questions and do a little bit of engagement and some Q&A around that. And Jetta will be the main presenter. Your training team will be there too. And if you or people you serve, of course, have questions about proposed waiver regulations, there is an online public notice that went out about that. I would encourage you to explore the online public notice. And if you have questions and comments, to email Jetta Whitaker. And that would also be okay for individuals and families to do as well. And it's important that you engage in those processes that way, because public comment is exactly that. The reason it exists is because we want public comment. It's not a time for your training team to answer questions or clarify or any SDS really. It's just a time for public comment, and it's really important. And it's really important that you know the difference, and that you, of course, if you're affected by it, you're welcome to interact. And individuals and families who are affected by it and interested in interacting are also welcome to interact. Okay. Okay, I'm going to go to a couple questions here and see if I can see those first and be able to maybe answer a few. Okay, Jetta will be on the webinar tomorrow. Yes, Jetta is the main presenter. Question says, is John Lee and Commissioner Wall on this call? No, they are not currently on this call. They are willing to participate in this call on an intermittent basis, and it's proposed that they'll be on the call about once per quarter. So they're not here today. However, we are working with the feedback that you provided, and the leadership team is aware and has received documentation of the feedback that you provided, and work teams are set about providing answers. And we know loud and clear that you're wanting to see efforts and answers towards these things. And your training team has been part of that too. So look for more interaction about that too. Okay. Question says the TPL announcement, third party liability, will change care coordination providers. It is the most significant thing that care coordinators want to know about in this info share. Is there a way to get collective questions to send so we don't inundate her? That is entirely up to you. I really don't have anything to add. If anybody who's affected by those things, those proposed changes, should participate. And because the instructions are given in the announcement to email Courtney King, that is the answer that I have to give you. I really can't. It's entirely up to you. We're members of the public who are affected by it to participate, follow the directions, and participate. Okay. Says, I can't find Kara's email regarding waiver amendment webinar. That email was just sent out yesterday to invite everybody to register for this webinar today, and just as a reminder. So it's out there. Were we planning an info share on the TPL? No, you need to please get with Courtney King about your feedback and your questions, comments, and concerns. Okay, so I did get some questions about Appendix K, and I'm going to review our previous e-alert that went out to help us clarify a little bit about Appendix K. I have, here's I'm sharing the actual e-alert right here. So the public health emergency exists for another 90 days past October 15th, okay, and it gives a link to that. CMS has approved for us to continue Appendix K flexibilities until 6 months after the federal public health emergency ends. So the end date has been extended to mid-January 2022. As of this moment, Appendix K flexibilities would end approximately June 18th if the PHE on a federal level is not extended again. Okay, and that's what it says right here. Okay. The flexibilities that are permitted to continue, they list them out. Okay, settings, service limits, expand settings where certain services can be provided, continuing to pay legally responsible individuals, modifying provider qualifications, renewing support plans without holding face-to-face. That just means, you can continue to, of course, do care coordination via video chat or phone or something like that. Okay, and so 1135 is a little different. That is about personal care, right? So the 1135 allows a personal care of a legally responsible person to provide reimbursed PCS, CFC excluding personal care and chore allows a legally responsible person to be paid to provide chore and CFC. So the difference here is that those things end when the public health emergency ends, not 6 months after. Okay, so whenever the federal resources declare the public health emergency is over, then these flexibilities listed here would end. And it's a little different because the waiver ones extend 6 months after. Okay, so that is my best answer on the date. I don't have any different information as of this moment regarding the public health emergency and the Appendix K. And as you know, we are looking at making a short form, so potentially we could have a shorter form to work with for renewals under certain circumstances and conditions. And I don't have a whole lot to add to that right now today. Okay, it says, I'm looking at your questions. Hang on, looking at your questions. When is the last time you can turn in Appendix K rather than a full plan? I'm hoping that is answered by what you see on your screen. The best information that I can give you is that it'll be, the flexibilities are extended until approximately June 18th, but just note that that could change, could be extended after that, could be ended sooner than that. This is the best information I know right now. And so you would have to follow the rules about turning in plans per regulation, right? I'm not talking about that. I'm just talking about the end of the flexibility. At the end of the notice, it states SDS will provide additional information on support plan submission and other process changes. Can we continue to submit AppK for renewal for plans starting after April 1? My best answer right now to that is yes, until June 18th. Mm-hmm. Due by June 18th or expires before? No, due by. Question says, it looks like Courtney is only taking public comment, not questions. Are you sure she's the right contact for questions? Here's what's stated in the proposal. Individuals may submit written comments via email to courtney.king@alaska.gov. Yes, I am sure. Like I said, there isn't any distinction. It's at this point, it's hard and easy to understand at the same time. Is public comment period is for the public to, you know, look at what's proposed, develop a reaction to it, develop a response to it. And if that's submitted in the form of a question or in the form of a statement, there's no requirement for that. It's public comment. Okay. So it can come in as questions, it can come in as statements, it can come in any which way. It's just public comment. That's it's welcome, is what I'm saying. Is it possible for Courtney King to present during the care coordinator session next month? Traditionally, and as per public comment rules, we're unable to offer advice and guidance and other types of things like that during a public comment. You know, I'm not sure. Of course, we could ask, you know, but the classic response throughout time and throughout my work with government is that during our public comment period, it is to solicit public comments, be they questions, comments, or concerns. Okay. Question says, what about Appendix K plans with supported employment? Can those be submitted through the renewal date of 6/18? You know, I have to go back and refresh my knowledge about supported employment. I will get back with us about that one. Okay, let me look into that one. There's something in the back of my mind that says I need to offer some more clarification about that and supported employment. And I wouldn't hold on to that date as I mean, it's a guidance date, okay? So it might be extended, and we've been in this situation before, right? So, you know, I don't want people to think, well, hey, you know, we had this webinar and Kara said it, we were able to do this, and then you're stuck in a situation where you're told that you have to fill in a full plan, okay? We reserve the right to ask for a full plan regardless of the flexibilities. And usually we'll do it if we need more information or if there's a change on the plan and it's sort of being presented to us as not a change. Okay, so it could even be, there could be just, there's any myriad of situations that could happen where they'll ask for a full plan. Okay, so just be aware of that. It says, am I understanding correctly? Appendix K can be used for plans that do not renew after June 18th. They're good for plans that renew before June 18th. And the other rules apply. Okay, not just simply that. I'm reading. I think getting on schedule with director leave would be good to get scheduled. A lot of people feel like they're struggling with what feels like a complete lack of help or clarity from the state. Yes, okay. Your point is taken, definitely. This is why we had the meeting and why Director Lee had the meeting. He's very interested in helping our care coordinator community. And also our Deputy Director, Anthony Newman, is very interested. As far as people's schedules aligning and things like that, they're highly interested in coming to one of these outreach meetings once per quarter. And we're always happy to relay to him the desire, to have more meetings and, engagement with care coordinators, of course. Okay, so individual circumstances, there's a question about submitting a full plan. The Appendix K was submitted on time and somebody at SDS requested a full plan instead. That is not, would the full plan be considered late? So there's some implications to that. I'm just going to say that you need to do due diligence and send in an Appendix K for appropriate circumstances, send in a full plan for appropriate circumstances on time. And if you get into a situation where a full plan is needed instead, then that individual review team will work with you. Uh-huh. Says, I think care coordinators are just asking questions from the state because families are asking us and we don't know the answer. We can't wait until Jetta gets back to us. Um, I get it. Hopefully the resources that we have available to you here would help you connect with families. Individuals and families are also welcome to peruse the public notices. People are encouraged to do that. Mhm. Okay, thanks. A note says previous e-alert on 11/4 said support plans, including support employment and renewing after March 30th, need to be full support plans. Let me get back with us on that, okay? I'm gonna research that and see if I can get any clarification or any updates through the teams. Okay, if there's any more specific communication to go out about that. Okay. So, okay, I wanted to ask us about this. Um, this here, I'm trying to highlight it and I'm going to share my screen. Okay. It took my highlight away. Okay. So in the document here, we are very excited to be working on our learning management system. And our learning management system is basically an online engagement with care coordinators. We're starting with care coordinators. It is a website that a care coordinator um, will be invited to, care coordinators will be invited to join us in our learning management system to receive your trainings. And it has different ways to engage with the material. And we're designing that right now. As you can imagine, our beginning care coordination training is quite complicated. So we're hoping to do more kind of digestible units and to break down this complicated information for a newbie and allow them to demonstrate their learning as they go through it. And this is all of things that a learning management system can do. If you've ever been to whatever school as an adult and you've been on something like Blackboard or Moodle, or even some of the proprietary trainings that agencies offer, it's probably a learning management system doing it. So you get a username and a password, and you go and you pick out your classes, you sign up for them, you engage in them. Part of them, most of them will be self-paced, just like most of our trainings are done self-paced right now, with some engagement in our learning units. Like we'll have, for example, quizzes and activities. We'll probably have some, boards where online boards where people can share their learning. or share their reflections. We'll have some different games and things like that that are related to the material so that people can progress through each unit. And then we'll have the ongoing engagement comprises the exam. So there won't be a final exam. There'll just be units to complete. And then we'll meet with our learners in each cohort. We'll meet with them for a capstone session, kind of like our office hours right now, sort of, where we have people who have completed that come to us and give us their final summary and just engage with us and ask us questions about what they learned along the way. And then we'll issue a certificate of completion. And so this is going to be our LMS. We'll have other things in the LMS, other units that we're planning for a care coordinator who is an experienced care coordinator to go through renewal training. Something that's heard that our trainings, should be very relevant. And so we're working on all those things and make them easier to engage with and kind of at your own time and pace type of thing. So we're working on all that. Basically, we want to have something ready at the beginning of February for a new care coordinator, to go through this course selection, course offering in February. And so we need, if you would please, and it will provide CEHs. And the nice thing about it is that it'll issue you a certificate right when you are finished. And you can also go back in there at any time using your username and password and get a copy. Okay, so you're going to have your own little area there. You'll have your own little account, and you'll have all of the classes you took and you'll have certificates. So you can just kind of go in there and track it like that. Okay. So that'll be really nice. But what we need is some care coordinators who are willing to pilot with us the beginning care coordination training that we're building. And what we would like to ask from you is that we need about 5 care coordinators who are willing to do that and give us feedback along the way. We need 5 of you, and we need you to know that we are making it available to you, the first 5 pilot folks, as good for renewal training and good for 16 hours of CEH, the whole thing. Okay. And so estimated time expected. That's the only, it says, will we be compensated? Okay. The only compensation I could give you is, we could give you credit for renewal training, and we could give you your CEHs. So we are not sure how long it would take an experienced care coordinator to finish. We're kind of looking at it from the standpoint of a beginning care coordinator. So I don't know. Delight, do you have any thoughts on that? How long it would take for engagement for a pilot
Don't we
to?
have an
So,
estimate of 30 hours
yeah,
or
when
less?
we say we're
For a
estimating
newbie.
a new
Hmm.
person, probably 30 hours to work through the curriculum. That would include reading time, research time, and like processing
Hmm.
time. So we anticipate that it would take a full 40-hour work week, like 30 to 40 hours, because it's for a beginning care coordination certification. Right now, we have 3 components of beginning care coordination. Self-serve, so people take it on their own. And then we have 5 live classes in a week to complete all of those course structure, or like the core concepts. So thinking about it as far as adding in additional think time, we are estimating that it's 30, but we're not sure. I would think that an experienced care coordinator really digging in and giving us a lot of robust feedback, it probably would take you some time. We're planning on having it available so that if you wanted to take the course and certify, you'd have up to a full month to complete it. So you wouldn't have to block it in of like, this 1 week in the month, I'm going to go to every single one of these webinars. It will be more self-serve, and people could do it whenever they wanted to. But the final outcome is that you have to meet with SDS training, and discuss the like final project kind of component to it. It's not anything crazy. It's more to prepare
Yeah,
people. So
there
that's
are
what we're thinking on right
sure
now.
there are
Like,
questions. We don't think it's gonna take an experienced care coordinator in our pilot to 30 hours. We're not expecting
yeah,
that. We're
no, it
not
would.
expecting it to even, I mean, we're just calling it as an equivalent, like your renewal training and your 16 hours of CEH. We're calling it an equivalent, and we just need you to do what you can, but we need you to also, help us out so that we can make training better. Okay,
It
so
would
it
be.
just really is just a partnership.
Yeah,
So,
thinking about it, if it was all brand new information, we would guess right now that it's 30 hours because you're experienced and you know what a waiver is, you know what level of care is, you know
hmm
what, the different service types are.
hmm
You request them every day. Um,
hmm
it would take much less time. The things that we're
yeah,
interested in is how user friendly the navigation is, how helpful it is to introduce those concepts. In
right,
the
and
future, we're wanting
sure.
to build it out so that we could be like have a deeper dive into specific service types so that
hmm
a experienced care coordinator could take a whole class on supported employment or a whole class
hmm
on EMODs or something like that. That would
hmm
be more in depth. So that's
Right.
that's
We
what we're
just,
thinking about.
yeah, we just want your feedback on the formatting. You don't have to, I mean, of course, if you see something in the content that's wrong, of course, but we want you to like help us understand more about how a new care coordinator would take what it is that we build. And yeah, so I mean, we don't want it to be burdensome. Some folks are saying that, there's concerns about the TPL announcement versus what we're talking about right this second. I get it. And we were just talking about our training team was just talking about how we kind of have this kind of storm of things there are three big things and now we have our thing and it just makes it confusing. But
This
no, we don't want it to be burdensome, but we don't want to just create training in a vacuum. And we do want to offer something to you to help us with this. And we're not wanting to, like, we're not going to evaluate. We just want to partner with you on that. We need to get your feedback and we can offer you completion of training and it takes as long as it takes. I don't think it would take you 30 hours. I don't even think it would take you 16, honestly. But
Yeah, remember we're kind of gauging it. We're just not sure, kind of like
mhm,
we're not sure. So that's kind of where we want the piloting impacts on it. So Kara,
mhm,
I did find the App K form e-alert that
mhm.
was up and gives the specific dates. Would you like me to show that? Would that be helpful?
AppKE
Um,
alert. Was it the one that I just showed or no? Something different?
Okay, so I remember this very clearly because it was very confusing, as usual. Like, there's a lot of things happening at once. The email that, or the alert you initially showed,
Mhm.
does not explain the app K form components to it. And that was done
Uh-huh.
intentionally.
Mhm.
They released another
Oh.
alert shortly after that that
Mhm.
specified that SDS will
Okay.
accept the App K form at least through April 11th or April 1st, 2022. So I can show that. So up to April
Okay.
1st.
Yeah, go ahead and do it. Folks are asking how do we get involved with the pilot if we want to be. Just email us at sdstraining@alaska.gov. So we'll just take the first 5 that we get and tell us that you want to be part of it. And like I said, we can offer training, renewal completion and 16-hour CEH. Uh, and your partnership with us is extremely valuable. And so we really would like to do that.
We're really only asking because you're the experts. Like that's a lot
Mm-hmm.
of it. You're doing the work. So we want to make sure it's legitimate and that,
Mm-hmm.
as an expert in the field, is the training legitimate? So that's why we're partnering with you. So this e-alert, I am going to drop it into our into your questions box so that you can get it. All of you get it. And you can click this link and see it for yourself. Okay. So I sent that to everybody, and I'm going to drop it into the chat as well. So you can get this in multiple, you can grab it either way. And the big thing here is that the short form is planning to be released when AppK ends, okay? But you can't bank on those happening at the same time. Right now, the information we have is that SDS will accept AppK short forms through April 1st. This means renewing support plans with start dates prior to March 31st that have no requested changes from the prior approved services. Oh, and my stuff is all blocking the rest of that. Can be submitted on the AppK short form. So all of the flexibilities that we were talking about in the first email regarding like guardians and certification flexibilities and that laundry list, that all goes out till June at this time as far as we know. AppK flexibilities specific to securing distance delivery, so our in-person requirements that are currently flexible, okay? So you don't have to meet people in person right now. And the short form, those are in play until April 1st. We're hoping to have a more permanent solution for those two elements so that we can continue to have distance delivery after AppK flexibilities are all over with, and we're going to use the short form after all these AppK flexibilities. So hopefully this is kind of like our last round of short forms for AppK, and our entire requesting process is going to change to include a short form permanently. And like Kara said, at any time you turn in a short form that's saying we're requesting for the services that were previously authorized using this shorter form, SDS could look at it and say, no, we need the full form based on what you've submitted or what's going on with the client or whatever. So that's always at play. So hopefully that gives some context. So there's a question, are you saying that we may be going back to in-person on April 1st? No, the intention is to focus on having the flexibility become permanent so that we could have it for long term. That's the thought. If SDS can't get all of the ducks in a row with CMS to make that happen, they're more than likely going to message out that it'll continue. Okay, so what's the difference? Why is there a difference between June 18th and the March date? SDS is trying to make these two items that you see on here, one in this one and this one right here, they're trying to make them permanent and not a flexibility anymore. That's why they pulled them out of that laundry list of flexibility. So it's moving towards making them permanently a part of our processes. What if it doesn't happen? That's going to be a whole new messaging cycle. So if I'm preparing for my plans in the next couple of weeks, which that's where we're all at, right? Like you're doing your planning meetings right now for March. You should know that if your plan has a date of March 31st, that's the last day that you could have it be effective for, okay? Everything after March 31st, support plans dated after that, are no longer going to be available on the AppK short form. SDS is looking at having a permanent short form in play for that April timeframe. So hopefully that gives you some clarification. The permanent short form is going to be a whole rollout. There's going to be, like, we're preparing for its rollout behind the scenes at SDS. We're working on it and trying to map how that works in Harmony and what that form looks like, all of that kind of good stuff. So that is where that's at this time.
Yeah, that's true. We'll accept the Appendix K through March 31. It says at least, so
They could
that
change their
sort of
mind and keep
implies that they could
extending.
extend it again. So, that depends on the progress and remember, just because, we have a lot of competing, shifting priorities too. So if work teams are able to produce the short form to replace the Appendix K in time, then they'll do that. If they need to extend it, the Appendix K, then they'll extend it. And we don't have, I get it. There's a comment that says, why not just extend it? Well, we'd have to check in with the teams and see where they're at with the short form project. We don't want to, have two separate forms at play at any one time, because that's really confusing. But there's a lot of different competing priorities right now. We know that there's, that we're subject to the same circumstances as everybody else. Workforce shortage, everything else under the sun. So that's why it's harder for us to make the answers that we want to hear right now.
Just remember that because of this pandemic, we're all trying to adjust in real time, and governments aren't notoriously good for it's hard to adjust an entire bureaucratic process in real time. We're doing our best to do that in a pandemic. So we're just flexing as we can. But you'll be informed if it extends out past March 31st. Either way, you're going to hear something. It'll either be extended past March 31st, or there will be a short form that will be introduced. So it's going to be one or the other. It's going to be, hopefully, that's the lay of the land as far as where this is going with AppKs. Anything else you have on that, Kara? I see that we're at 3:05.
I don't right now.
Okay. So I'm seeing a couple more questions of like, when can we see the short form be introduced and stuff like that. Like Kara said, we have to check in with the other teams that are devising it, and we can go from there.
Right. Good questions, though. I'll definitely bring those to the teams. So, yeah, good questions.
You guys are always on top of it. I think that's part of the job description of a care coordinator. You are on top of it. You have to be managing so many different components on one case, and you're managing caseloads that are just they're just astronomical. So we want to just, as always, convey that we appreciate you and all of your dedication to the details, because the details make all this work. So awesome questions. Thank you for bringing them to us. Consider being a part of the training piloting, but if you are too busy, totally understandable. And if you have questions, you're always welcome to join us in training office hours, Tuesdays and Thursdays. So after this session, we'll probably open it up and just be available for additional questions. And we will be sending you the T24 for Harmony. So if you want, that'll be going your way here in the next hour or so. So if you didn't pull it through email or through the webinar, you'll be able to access it via email. But yeah.
And you will get CEUs for today. The system will issue you an email with a link to go download your certificate. Okay, so look for an email with a link and then go download it. If you have troubles downloading it, you might want to try a different browser, because sometimes it's a little, I've heard it maybe once every bunch of webinars that people can't see the certificate. So you would want to try a different browser for that, but I don't anticipate trouble.
Most recent web browsers, the the best
Mhm.
browser. So like the
Mhm.
latest version of Chrome, the latest version of Edge. You should be using
Mhm.
Chrome though. Harmony works best with Chrome.
Mhm. Okay, and if you're interested in being part of the pilot to gain your renewal training and your 16 hours all in one effort, email us at sdstraining@alaska.gov. We only need 5, so hopefully we'll get that many. And if we get too many, then we may just not pick everybody. So all right. So thanks again for all your assistance and your help and for everything that you do. On behalf of our training team, Happy New Year. And we'll see you very soon online. Thanks again. Goodbye for now.